I'm Dr. Patel. Today we'll talk about a little bit different topic, probably something that your regular cardiologist often doesn't get time to chat about. We'll talk about common toxins that are in the environment and how to avoid those and how that might be impacting your arrhythmia. Basically, arrhythmias are the electricity of the heart. And so this is kind of like the ventricles, we have some atria on top, and then there's a septum. What happens in the heart is that there's electrical activity that comes down from the atria to the ventricles and then conducts kind of like that. But this is basically how the heart beats. What causes the electrical activity of the heart is that in the cell, there are some ion channels. And these ion channels let various molecules, like for instance, like sodium, potassium, so it lets some of them in and then some of them out. And there are other ones like calcium as well. So a lot of the drugs, that some of you are on basically modify these ion channels. What controls the electricity of the heart and makes it beat are these ion channels. The medicines that we prescribe try to restore the electrical activity of the heart by stabilizing these ion channels. So toxins basically do the opposite. They destabilize the ion channels. The toxins, they can be a variety of things. Some common toxins include things like alcohol. Many people are social drinkers, but just be aware that a single glass of alcohol has been shown to induce arrhythmias. When you drink alcohol, you have some enzymes. So for one thing, people talk about benefits of red wine and 1 glass a day. I've heard those things. But when you actually look at the data, benefits of alcohol and things like HDL are only found in people who do zero exercising. And even then, I would caution that there are probably better ways to increase your HDL cholesterol. But that said, if you do partake in alcohol for social reasons, that's okay. I would just really encourage you to moderate that. Make sure it's important events only and not a regular occasion. And then also you would want to do it away from bedtime. But alcohol gets metabolized by the liver into a toxin that's called acetaldehyde. It's the chemicals like this that are responsible for increasing the risk of arrhythmias. The other way that alcohol does increase your arrhythmias, if you drink it a few hours before sleep, basically it actually decreases your deep and REM sleep. And actually this is the most restful part of sleep. Basically there's only a couple stages of sleep. There's light sleep and then there's this deep and REM sleep. And unfortunately alcohol, if you drink it a few hours before bed, interestingly, it helps with sleep onset, but it decreases the more restful sleep. There was a study done at UCSF that 1 drink of alcohol increased the risk of someone going into atrial fibrillation, for example, by 20 times. And then similarly, a poor night of sleep dramatically increases the risk of going into arrhythmias the following day.